surgeon at the University of Nairobi, and also Ruth McKenna, who is the founder of Gigantomastia Foundation. Thank you so much, ladies, for being here tonight. Dr. if I may start with you, at what point will I know that I have that problem?
When the size and the weight of your breasts are preventing you from just carrying out normal daily activities, then you know that it's a problem.
And how is it diagnosed?
Majority of the time, most of the time, it's a clinical diagnosis. There is no test. So it's mostly what the patient presents with. So it's usually a patient who comes with very large breasts, complaining most of the time of severe shoulder pain and back pain. They may have skin changes on and off the breast. And they may even have, just because of the size of the breast, the psychosocial stresses of the condition make them now want to have treatment.
You're talking about the size of the breast. How big is it usually?
So for gigantomastia, the definition is if you have one breast weighing more than 2.5 kilos, whereas macromastia, which is a less moderate form of the disease, is when you have one breast weighing as much as 1.5 kilos, just one breast. So totally you can have as much as 3 kilos just on your breasts.
Ruth, you're a survivor of gigantomastia. How challenging was it for you?
Okay, when I was diagnosed with gigantomastia in the year 2011, I was having recurrent shoulder dislocations as a result of my breast weight. That is when the orthopedic surgeon referred me to a plastic surgeon in Aga Khan, Professor Stanley Hainga. So we went into theater and he removed a total of 7.3 kilos off my chest, 3.9 on the right and 3.4 on the left. Yes.
That's really huge.
Yes.
So how common is this disease? Is it a disease? Can I call it a disease?
Yes, it is a disease.
So how common is this?
I would say it's a very common disease that women suffer unknowingly. As the doctor has rightfully put it, it's a symptomic and it's a clinical diagnosis, because you can find a lady is just having persistent backaches, neck pains. Like me, I'll speak for myself. I could just be dislocating my shoulders and I cannot point anything to what is making my shoulder dislocate up until I was diagnosed with gigantomastia. So I can say very many women are suffering with gigantomastia unknowingly. Yes.
Dr. what are the treatment options for this?
So treatment involves a surgical procedure known as reduction mammoplasty, where we go in and as plastic surgeons, we remove the excessive breast tissue together with skin and fat. Then we're able to reshape the breast into a size that is more suitable for your habitus, your body habitus.
So you're talking about a breast reduction?
Yes, it's
and
a breast
this doesn't
reduction.
come cheap?
No, it doesn't.
So how much can one breast reduction cost?
The cost in Kenya ranges from about 500 to 800,000 shillings.
So are there any, because that's a lot of money for somebody who can't pay for that treatment.
Yes.
Are there any alternatives?
You may have cases where you have large breasts due to your weight. So if you do lose weight, you may reduce your breast weight. But in such cases, we've seen that even when you do reduce your weight, the symptoms persist. So you still have to come in and do the surgery just for you to have the relief of the symptoms.
What about medications? Are there any medications a woman can take to reduce the breasts?
No.
No medications?
No.
So it's just
Entirely surgery.
Surgery?
Yes.
Okay, and what drove you to have this foundation, Ruth?
So what drove me to start the Gigantomastia Foundation is, first, there's a very big need of awareness, because as I said previously, that very many women are suffering in silence. That is because it is a result of lack of knowledge of what gigantomastia is. So my main aim was to have awareness done, help the people know that it can be done, especially locally, because so many people have this mentality, I have to go to India, I have to go to America to have this surgery done. As today you can see, we have the pleasure of having a plastic surgeon on the panel today.
But 500,000 is a lot of money.
Yes, and it's unfortunate that insurance also do not come on board to pay for this surgery, because they classify it as a cosmetic surgery. To some extent, they say it's a pre-existing condition, which is very unfortunate. If you cannot do your day-to-day activities, be proud of yourself as a woman with what defines you as a woman, which are your breasts. It's quite unfortunate. Yes.
And what happens what are the implications to this if it's untreated?
If it's untreated, you just have a worsening of the symptoms. So like she said, you can have the persistent shoulder dislocations. You can have severe neck and back pain to the point where you may be unable to even walk. And then the skin changes may persist and progress to infection, and sometimes you can even have ulcers on your breast. And the psychological stresses, there are patients who even come in with features of depression just because of the condition.
But I also want to find out from you, like 500,000 honestly for a woman, it's too much. So Ruth, does your foundation help with funding?
Yes, sometimes.
Do women come to you? How many women have you helped so far?
Like in a span of 3 years, we have done 80 surgeries successfully. We have reduced, and the highest was a 13-year-old who we removed close to 9.5 kilos with the support of His Excellency William Kabogo in Kiambu.
Okay.
In the Kilifi County, we also had a 13-year-old who was sponsored by the county, and she had a total of 8 kilos. So you can see there's a lot of support and need for these women to be supported. And that is how we come in as a foundation. We lobby for funds, we lobby for the county government to come in, because this is something that needs to be given attention as much as diabetes. The people are making noise that diabetes every other day, HIV, fistula, also gigantomastia should also come on board as well. Yes.
Thank you so much, ladies, for speaking to us about this.
Yes.
Let's take a short break. We'll be right back.